presentation that I'm going to be doing is the effects of TAC training on emergent intraverbal vocal response in adolescents with autism from the Journal of Autism and Developmental Disorder, published August 25th, 2012 by Richard J. May, Emma Hawkins, and Simon Diamond. The background information. Evidence supports the educational use of Skinner's analysis of language in children with autism spectrum disorder. Past research tends to look at verbal operants with only a few investigating the intraverbal relationship of mind, TAC, and echoic. Several studies examine how TAC training provides intraverbal forms using two forms of stimuli, AB and BA emerges. The current study extends previous research by using three forms of stimuli, AB, AC, and the new untaught intraverbal BC and CB vocal responses. The purpose: to continue the research in the use of TAC training in children and adolescents with ASD and language disorders. To evaluate the use of three stimuli, AB and AC, with the new intraverbal BC and CB. The participants and setting. There were 3 male participants diagnosed with autism that were recruited from the school and focused in special education for children and young adults. The 3 participants were John, who was an 11-year-old who had an equivalent score of a 5-year-old, Rob, who was a 16-year-old with the equivalent score of a 9-year-old, and Sam, who was a 15-year-old with the equivalent score of a 5-year-old. In this setting, the sessions were done and data was collected in an empty room at a school with only chairs and tables. The assessment used was the British Picture Vocabulary Scale, 2nd edition. The dependent and independent variables. The dependent variables, percentage of the correct verbal responses during test trials for emergent relations during pre- and post-test. Measure of the percentage of correct responses during AB and AC training. Independent variables, the implementation of TAC training. The method used for the data collection. So we had the pre- and post-test training of participants measuring correct responses by 2 independent observers. Percentages of correct responses calculated by dividing the number of trials agreed upon and by 2 observers that both agreed and disagreed were multiplied by 100. The method used to calculate the inter-observer agreement was the point by point, and the range was between 87 and 100%. Research and design. A non-concurrent multiple baseline was used to evaluate the effects of TAC training on the emergence of intraverbal response in all 3 of the clients who were chosen for the study. So the experimental phases consisted of pre-training, pre-testing, training 1 through 4, and post-test. Procedure for each phase. Before the session, an explanation of the study was provided to the participants. Each was presented with a jar, a plate, and 30 marbles. The experimenter would ask if they would like to win a prize, but stating that they would have to perform correctly. A correct response by the participant would result in the experimenter announcing "good job," and then instruct them to take a marble. Once all the marbles are moved from the plate to a jar, the participant wins the prize. Each of the phases consisted of 8 trials, except for the 4th training, which consisted of 16 trials. Pre-training. So this consisted of the presentation of a familiar stimuli, so participants would become familiar with information presented in the upcoming pre-test. So during the first trial, we have the AB. The stimulus was the presentation of a monkey. The first participant was asked to touch the picture, which was an observing response. When asked to name the picture, the correct response was monkey. If correct, the experimenter would respond positively by saying, "Nice job," and then ask the participant to take a marble. If the response was not correct, or no response given within 10 seconds, the participant was not asked to take a marble. During the second trial, which was the AC trial, the initial presentation of the stimulus picture was the same as the first trial, so which would be monkey. The participants saw the picture of the monkey, and then the experimenter asked, "What do they eat?" waiting for the appropriate response, banana. If the participant responded correctly, they received the marble and praise, "Well done." If incorrect or no response given, no marble was received. During the third trial, which is BC, experimenter used vocal stimulus by asking the participant, "What food does the monkey eat?" looking for the response, banana, within the order for the participants to receive a marble and praise. The fourth trial consisted, which would be CB, and the presenter asked, "What animal eats banana?" waiting for the correct response, monkey. If correct, a marble and praise were given to the participant. Participants were exposed to both the tasks AB, AC, and interverbal BC, CB with no feedback provided. The pretest consisted of 8 trials. Marbles were given for on-task behavior. The pretest was given as the baseline measure. Wait time between each trials took about 3 seconds. So AB trial, the provider provide the name B when shown a picture of the character A. The AC trial, identify the food C, and when shown the picture of the character A. The BC trial, verbalize the food C, when told the name of the character would be B. Training 1, AB TAC training, was presented in an inconsistent manner throughout participants. 7 out of 8 trials had to be correct for a participant to move to the next phase. The purpose, the participants are taught to correctly identify the character in the picture, and the correct responses for monster would be Simon for cartoon picture 1 and Rocky for cartoon picture 2. During AB, participants were asked to touch the picture. When the participant touched the picture of the monster, they were to identify the correct name within 10 seconds. If correct, they would receive praise and be asked to take a marble. If not correct, presenter would state "not correct" and provide the correct name of the character, and no marble was given. Training 2, which is the AC TAC training, is the same format as Training 1. During AC, the experimenter asked the picture. The experimenter presented the picture to the participants and asked, "What does the monster eat?" The correct responses would be chips for cartoon picture 1 and apple for cartoon picture 2. Correct responses would, within 10 seconds, would receive praise and asked to take a marble. Training 3, which was a mix of AB and AC TAC training, so this continued to be presented to the participants with random assignments from trial types from both trainings 1 and 2. So the correct response continued to receive praise and a marble, and correct response would be corrective feedback but no marble, and participants had to receive 7 out of 8 trials to move to the next trial. Training 4 mixed AB and AC TAC training and 50% feedback. So the purpose of the trial was to reduce the proportion of the trials and estimate the rate of feedback to be presented during the post-test. Trial types were the same as trainings 3, but during this phase, participants were to respond in the absence of feedback for 50% of the total number of trials. The number of trials increased from 8 trials to 16 trials. Participants were instructed that they will only take a marble after some answers. The participant wasn't told if their answer was correct and not instructed to take a marble. Trials that did not have feedback, there was no given praise. Trials that were reinforced, presenters gave social praise and was asked to take a marble. All of the trials were random and predetermined in each block. To pass Training 4, participants had to have 14 out of 16 trials correct. Post-test. designed to test the accuracy of participants' responses during a series of reinforced trials and emergent interverbal non-reinforced trials, presented to be in identical manner as the pretest, with the only exception being the feedback provided during baseline trials. 8 trial blocks delivered with feedback given for correct responses only. As in Training 4, marbles were still given randomly for some but not all of the responses. The graph. So the graph shows the number of correct tacks during the pretest and post-test. The solid dot indicates the top baseline, and the open squares indicate the emergent relations. The graph indicates that having taught the skills before implementing the intervention, the vocal skills were to increase. The conclusion. TAC training was ineffective in the treatment with individuals in ASD and developmental disabilities. An important feature of the study was that 3 experimental stimuli were used in training sequences. The findings may provide important in curriculum design aimed at improving vocal skills, which is difficult when planning special education programs. Choosing 2 stimuli would not have resulted in improving emergent outcomes. Results show that the following training was given a picture of a character. Participants were able to answer questions without further teaching, and by improving verbal communication outside of the teaching environment, individuals with autism and other developmental disabilities will improve their social skills and therefore improve communication in the community. Critique study. The purpose was clear, and it was important of improving the verbal skills of the individuals with autism and other developmental disabilities as essential in improving the quality of everyday life. The results of the study demonstrates the importance of this type of research. New method of developing curriculum for individuals with disabilities is critical to improve their language skills. Measurements of training and testing results showed an improvement in overall interverbal skills in all participants in the study. The 7 dimensions of applied behavior analysis. The study showed social importance. The study provided reliable results and was able to collect and show the results of each participant during the individual trainings. The training sessions caused a positive effect by demonstrating an improvement in interverbal skills. The intervention was clearly stated that another person would be able to implement the training. Improvement of the behavioral and interverbal skills was clear after reviewing the results of training and testing. TAC training was shown to be effective. Again, shown in the results of the study. With the intervention being implemented, there was a change in the skills of the participants. However, there still needs to be future research to show continued success for these types of interventions in individuals with disabilities and to develop new and innovative educational techniques.